There's a lot of evidence to show that being admitted to hospital unnecessarily and being subjected to long hospital stays can be harmful to patients. Given this position, Cardiff and Vale UHB continues to seek ways in which to further develop community services that support the principles of Home First, enabling more individuals access to the care and support in a community setting rather than being admitted to hospital.
Not all attendances to the emergency department require admission and can be managed with support, access to care and discharge planning provided here at the Community Assessment Unit. We also act as a stepping stone for patients following acute illness and act as a transition back to the community, particularly with those lacking in confidence.
Our practice registers patients in the Community Assessment Unit for a period of up to 2 weeks as temporary residents, and we provide the general medical services for the patients while they are staying within the Community Assessment Unit.
Part of our role is assessing patients at Cardiff within their first few days of admission.
Once the patient arrives, we try and give them a discharge date as soon as possible. This enables us to plan and carry out safe discharges home.
What we're doing, we're trying to help them as much as we can with the medication. We promote self-medication so the patients are able to self-medicate back home in a community.
Because of the environment is that they are far more active than they would have been in the hospitals or on the wards, even sometimes more active than they are at home. They are walking to meals very regularly with supervision and appropriate aids. They are engaging and socialising with other patients.
Residents coming in and out is very nice because then you've got a 2-week turnover, which you're getting to meet new people, new residents, and they all chatting together in the dining room and all mixing and really enjoying themselves. And you can see they're getting more independent with each day that they're here.
We've just done our 6-month audit of the scheme and we have had 89 patients who've completed and been discharged home. Of those 89 patients, 59% have actually gone home with fewer, less or even no calls from the CRT. So in terms of patient flow, our outcome measures are fantastic really. Not only have we facilitated home 89 patients quicker than they would have been, but also it means that we have enabled the CRT to have greater capacity to support those patients who need that care.
And we also feel this is a very good model for integrated working across secondary care and primary care, and we'd like to see this model extended for other patients within the community, particularly our more frail patients.
Well, I was in the Heath and they said they would move me from there to a transitional place, which is here. And I must say I was very, very pleased with it. I've seen an occupational therapist, a physiotherapist and a doctor as well. It's really relaxing from, say, the floor of the hospital to a place like this. It's very good.
The staff are very supportive. They can't do any more to help you than they're doing now. Excellent food, which is absolutely brilliant. And they do your laundry for you. You haven't got that worry. Visitors are allowed to come any time as long as it's not meal time. And it's a beautifully decorated place, and we've all got our own en suites and lovely.